All right, welcome, Word listeners, to another great night of Max Living Radio, Dallas, Fort Worth. This is Dr. Rick Royston and Dr. Chris Kordic. We're in studio tonight bringing you truth about health and wellness. And, you know, it's interesting. We were just talking about Dr. Chris and being at one of his patients' houses who had just passed away, and just the wife had wanted him to be there and just felt like he was a part of the family, and wanted him to be a part of that grieving process and healing process. And I was just thinking about how powerful that is. How many times do you hear of a patient like wanting their doctor to be at a wedding or come over after someone passes or things like that? Like, I never hear about that.
Yeah.
It just shows the power of the connection that you have with your patients and what you try to do to help that family, but also how much you care about your patients and just your heart that drives you to help as many people as possible. And it's so unique. You know, we hear that all the time in our office, like, wow, this is so different.
Mm-hmm.
It's I've never been anywhere like this. I've never experienced anything like this. And that's good, because we want a different response than what you get at other places. But, you know, what Dr. Chris was talking about was just the value of how important health is. And when you lose that, how it impacts people around you. You know, if you lose your health, it's not just you that suffers. You know, it's the people that love you and care about you that suffer. And not just emotionally, psychologically, but bills.
Yeah.
You know, the financial burden that comes along with being sick and being unhealthy, and how that impacts the people around you. You know, and I say that not to add another burden to your list of all the things that, you know, you're worried about right now.
Yeah.
But just to help you understand that these are things that you can take control over. You know, that you have the ability. And I think this is, you know, I think this is probably one of the most solid things that I believe in. You have control. You know, you have everything that you need inside of you to make these changes. You know, people say all the time, like, well, I'm waiting on the motivation, or I'm waiting on the self-discipline, or I'm waiting on this to happen or that to happen. Like, it's already in you.
Yep.
You have everything that you need. It's just you have to make that decision that I am going forward, that I am moving in the right direction. I am going to make a plan of action for exercise. I'm going to make a plan of action of how I'm going to eat. I'm going to take care of my nervous system. It's not going to be perfect.
Yeah.
Nobody is, and that's okay. But at least you're moving in the right direction. You know, quit using self-discipline and motivation and those things as excuses. Like, it's interesting. You start looking at research, Dr. Chris, and they can either prove for or against motivation. They can prove for or against self-discipline. It's just a choice you make.
Yeah.
It's just like when the alarm went off this morning, you either hit the snooze button or you got up.
Yeah.
You walked to the sink and you either brushed your teeth or you didn't.
Well, it's the same thing as, you know, the patient or the person that's trying to quit smoking. They're trying to quit tobacco. They're trying to quit alcohol. They're trying to quit an addiction. You know, and how come some people quit it, draw a line in the sand, they're done, right? And then other people, it takes this big process, you know, or it takes 21 days or 40 days or 6 weeks, or, you know, then the process is different for everybody, but it's a mindset thing. It depends on how much you want something. You know, and I was sitting back this morning just thinking about what we want to talk about here. You know, it's an overall view of what health is, and not to take your health for granted, and not to think that, you know, you're always going to have your health. And that, you know, you and I, we see firsthand, we see people struggling with their health in all different forms. I mean, we see people struggling with cancer. We see people struggling with just, debilitating pain where they can't even work. You know, you see people that are near suicidal because their headaches are so bad, and they're every single day, and they're relentless, and they never give up. The headaches never give up. And you see people that are depressed because of that. And what you see is, you can see this just, you know, when you lose your health, that can destroy your family. It can destroy the people you love. It destroys your finances. It is expensive to lose your health. And the reason I'm saying that is because we see this firsthand. And it doesn't mean it's expensive when you're taking the traditional allopathic medical model route, the Western medicine, which says I'm sick, I go to the doctor, I take medications and surgery. And it's expensive when you go the holistic method. So when you start doing other things, it's expensive either way, but you have to stop making excuses that, you can't afford to do things for your health, or it's going to go away on its own. It's going to fix itself. Eventually I'll just start to lose weight miraculously. You have to take control. You've got to say, okay, I'm going to make a decision now. I'm going to make a plan, and I'm going to start to get healthy, because I understand that if I don't have my health, I don't have anything. Right? There's nothing worse than as we go through this holiday season and you go to Christmas parties and you see people in your family that you haven't seen in a while, and when you see their health deteriorating, it's a scary thing to see.
Yeah.
And some of you guys, you're sitting there and you're thinking, well, is that going to be me someday? And the reality is you have to realize you do have genes. You are predisposed to certain things, but there's something even more powerful than that, and it's called epigenetics. And that means that, and I was listening to a podcast on this morning, there was some new research coming out about epigenetics. And, basically the gist of this and the research that they were talking about this morning is that, epigenetics is stronger than the actual genetic code that you're given. At birth, you have your genetic code and your genetic map, but the epigenetics means the lifestyle choices you make for days and months and years and decades of your life start to make up and build these genes. Okay, so the choices that you're making determines your health. It's not just that, your mom or your dad or your brother and their sister, someone had a disease or a neurodegenerative problem or something like that you just have to sit back and think that that's going to be you someday. You have to realize that the choices you make right now, where you are going to determine your health. And the choices you make tomorrow and next year and the years after that. So really, you have to start accumulating good health choices, good health practices. And that's what we really deliver in our offices, because I think about patients that come in, there's never a patient where I'm like, they've been under care for 6 months and they are less healthy than they were 6 months ago.
Yeah, no.
It just doesn't happen. I mean, and it's so hard for us to try to, describe this on the radio, what it is that we do and how we treat our patients and how the care plans work and all of these things, is because what we know is that when you're under care in our office, your life is going to get better. Your health is going to get better. You are going to sleep better. You're going to, decrease medications because you're not in the amount of pain. Your body's not misfunctioning the way it used to. Misfunction, I don't know if that's a word, but it's not. Yeah. So your body starts to function better. You're not having the interferences in the nervous system, which are creating dysfunction and are creating disease processes in the body, because we start to clear that up. So I just know that if you want a better quality of life, if you want to be healthier 6 months from now, a year from now, 5 years from now, being in our offices, being a part of this is going to help your health. There's just no ifs, ands, or buts. And we see people all the time, Dr. Rick. There's people that are under care for a year. They stop coming, and then they stop going for a year, and then they come back, and what do they always say?
Yep, it's back.
It's back.
I wish
It's back.
I
wish I would have never stopped. I don't know why I stopped. I thought I could do this on my own. It's all the same things, because you're not focused anymore on your health like you used to be. It's like all of a sudden, if I go to church, I'm having amazing results in my spiritual life, and then all of a sudden I stop going to church for a year. What happens when I come back? I feel disconnected.
Yeah.
I feel like I'm not the same person I was when I was coming to church. So
I think that's so critical to understand is, being a part of our office, there's the whole chiropractic portion that you can't duplicate anywhere else. Like, you can't say, I'm going to do an exercise or a stretch or yoga or anything else that will replace the adjustment. You've got that part of it. And let's take that out of the scenario, and just look at what we teach you in the engagement. And that's exactly what happens. Like, there's people, when they quit, they're not getting adjusted, so their spine is deteriorating. There's arthritis, there's pressure on discs and nerves and disease building and malfunction. But those people don't have accountability anymore. Mm-hmm. There's nobody pouring into them. There's nobody asking them how things are going and what their goals are and what they should be doing with nutrition and exercise and detox and mindset. All of that stuff goes downhill. And when you add all of that up together, then, people are going to be worse off. I mean, it happens, unfortunately, way too many times. People, and they typically always come back. And
the accountability is so huge.
Oh, it is, because you're not getting that anywhere else. I mean, most people, and I'm guilty of this too, but we surround ourselves with people that are willing to accept us how we are, and are willing to help us rationalize our bad choices. And so we don't really surround ourselves with people that are going to push us, that are going to motivate us, that are going to make us step outside of our comfort zone or our box. If you want to grow, I challenge you to do that. If you want to get better in some area, find somebody that will challenge you in that. And I promise you, you will get better. You will grow. And I think that is so just a huge part of our office is we want you to be uncomfortable. We want you to step outside of your box. And sometimes it is. It's like, it may feel like confrontation, or it may feel like, man, this is awkward, or it's uncomfortable. But really, it's out of love. Like, we have no other motivation except to see our community transformed for God's glory, to see people healthy and well, living to their fullest potential, living out the purpose that God destined them for, designed you to be. And that's where we get satisfaction from out of this. And that's why we love what we do. I mean, I promise you, we evaluate this stuff all the time. We talk about it. It's like, well, what could we be doing? Or what should we be doing? Or how can we do things differently? And we've chosen what we do and do it the way we do it because of it's the best results. Because people's lives transform the most through this. And that can be you. You just have to make the decision to go down that road. The number is 877-778-6978, 877-778-6978. And when you call in, you're going to get in contact with one of the offices. I'm Dr. Rick Royston in Plano, Dr. Chris Kordic in McKinney, Dr. Aaron Wall is in Fort Worth. And when you sign up for that appointment, you're going to come into the office that's closest to you, and we're going to do an exam. We're going to do some orthopedic tests and some neurological testing. We're going to do check posture and palpate your spine and range of motion. We're going to walk through the paperwork that you fill out and get a good history of where you've come from, what you've been through, and why you are where you are right now. And all of those things help us get to a point of, do we need to take x-rays or not, and find out what's going on, and then go over a plan of action of what we need to do to get you where you want to be. And it really, we say this all the time, it's not rocket science. But what we do, there's strategic steps that we lay out for you to help you. But ultimately, it's down to you. I mean, I think so many people come in, Dr. Chris, and they're really hoping that we're miracle workers, like that we could just snap our fingers and they're going to be better. It's your decision. It's your action steps. We're there to help guide you and help you and walk you through this. But ultimately, you're the one that has to take the steps. And, we see this all the time on the radio. People come in and go, how long have you been listening? Like, a few years.
Yep.
Why now? Why did you decide to come in now? Like, well, it got bad enough.
There you go.
Well, what if you didn't wait till it got bad enough? What if you started now and your life was radically changed in 6 weeks, 6 months, 6 years from now?
And here's the thing about letting it get bad enough is that there's underlying conditions in there that you just don't feel. You can't feel the arthritis and the degenerative processes. I mean, it's such a gradual process that happens over decades of your life that when we say arthritis and degeneration, we're talking about the spinal column. And we mean that those bones actually take a different shape. They have bone spurs on them. Your discs, they become smaller. And what happens that you can tell is your range of motion decreases. You have more headaches. You have more numbness in your arms or your neck. You have more pain that just doesn't go away. Yes, it goes away, but it always comes back. And then it stays a little longer and it comes back because of the dysfunction that is in there. So those things, don't just wait till it gets bad, because once it gets bad, most of the time you've got some irreversible arthritic conditions. We kind of had this wave over the last couple of weeks of some younger people coming in, and I say younger, 20 to 30 people coming in. And what I've been telling all of them is, you're at a position where your spine's out of alignment. It's not stable. And if you leave this there another 10 to 15 years, by the time you're 40, you're going to have major irreversible issue. Yeah. And because the problem is we see this on the back end. We see the people come in that are 40 that say, oh my gosh, how did this get here? And it's because we could have seen it. We could have stopped it at 25 or 30, but you didn't want to do anything about it. You wanted to wait, and so now you've got problems that are always going to be in there. And I think another good thing is just, this is chiropractic. This is how we start to change this. And I think, people, when they hear that word, they sometimes have a lot of preconceived notions of what chiropractic is. I don't think it's fully understood. I think a lot of it has to do with just our profession, the way we've marketed what chiropractic is. And I think, honestly, there's probably a little bit of misconception when people listen to our radio show for years and then they call in and they say, it's a chiropractic clinic? Because not everybody associates chiropractic with helping someone with high blood pressure, with helping someone with an autoimmune condition. But you have to understand that the basic principle behind chiropractic, there's two main things that I want my patients to get, is I want them to understand that there's a neurological component and a musculoskeletal component to chiropractic. If I could pick one of those, the neurological component is the most important.
Right.
But that's the part that people don't associate chiropractic with. They associate it with the musculoskeletal component, which is going to be the arthritis, the degeneration, the pain. This is why someone would come in because they were in an accident, is because they were in a traumatic event, and their spine got shifted very fast. That could have come from a football injury, a car accident, falling off the ladder, whatever the injury is. Something happened that threw your spine out of position. We know exactly what caused it, that moment. So that's more the musculoskeletal issue. The neurological thing is that the spine slowly, gradually starts to shift out of position because of little repetitive stresses and traumas. Sitting at a computer desk, sitting on the same side of the couch, playing on your phone, knitting, crocheting, doing whatever you're doing. And by repetitive stress, I mean doing the same thing in the same posture every single day that you have no idea you're doing. It could be sleeping. Okay, so when that starts to happen, it slowly starts to put pressure on the spinal cord and on the nerves that come out. And those nerves, they come out and they feed life into all your organs. So your heart beats, your lungs breathe, food digest, everything works because of that nervous system. But the problem is, and what we start to correct neurologically for people, is we remove the interference to the spinal cord and the nerve that's feeding life into the body. And this is the true beauty of chiropractic. This is the beauty of Max Living Care, is that we start to heal the body. We start to let the body, let me preface it, let the body heal itself naturally because we remove the interference. And this truly is what chiropractic is. We remove the interference, allow the body to heal. And when we say allow the body to heal, this is what means back pain, blood pressure issues, thyroid dysfunction. It's not that we're treating any of those conditions. We're removing the interference that's not allowing the body to heal it, and it's creating the dysfunction. So I think a lot of, where the show needs to go is for you just to understand, what is chiropractic? What is it, how we help people, and this is how we do it, and just so it makes sense to you that it's not rocket science. It's God gave you a nervous system to heal. And then when I sit down, after we take x-rays with a patient, I sit down with them, I go through normal x-rays and abnormal x-rays, and then I go through theirs, and I start everyone off like that. Okay, this isn't rocket science. Here's what the spine should look like. It should be straight. It should have these curves, And so once I explain 3 or 4 x-rays, it's like, okay, that makes sense. Then you show them their x-rays, they're like, okay, wow, my spine is way jacked up. Okay, so now it's in the wrong position. Oh, and it's in the wrong position, the same spot I'm having pain, or the same spot that I have digestive issues from those nerve roots that feed my colon, or from a woman with cystic problems, ovarian problems, hormonal types of issues in that. So hopefully that makes a little bit of sense, guys. The number is 877-778-6978, 877-778-6978.
Well, listening to you talk about that, I'm reminded of our last patient that just came in from the radio show. And I go through good and bad x-rays, and I show her what normal looks like and what it shouldn't look like. And she's like, yeah, that makes sense. And, that's not our theory or opinion. That's just how the body is designed. This is science. It's nothing that we came up with. And I think people get that. You can ask anybody in the healthcare profession. Like, we know what the spine is supposed to look like and how the nervous system is supposed to work. And she's like, that just makes sense. And then I showed her x-rays, and she's like, whoa. Like, that's bad. Yeah. And I said, yeah, it is.
And it's probably how in the world could have gotten like that. It seems to be the...
Yeah, they always say, like, what caused that? But she goes, well, I just came from a neurologist, and she's having numbness in her hands. She had neck pain, shoulder pain, and headaches. And she went to a neurologist. And guess what the neurologist told her? It's normal. Like, he said, it looks all fine to me. And I said... So again, you don't have to be a doctor. Here's what a normal looks like. Here's what it shouldn't look like. And I said, where does yours fit into that? She's like, oh, that is not normal. That doesn't look good at all. Like, I can tell that's bad. Because she was asking me, like, why didn't my neurologist tell me this? Why did he tell me that it was okay, that there wasn't a problem here? And I said, I can't answer that. All I can say is, here's your x-ray. This isn't normal. And she got that. And I think, I say that to for you If you've been to the doctor, if you've been somewhere and they told you that we can't find the answer to your problem, we don't know what's causing it, we don't have a solution to this, or that things are normal or that it's okay, and you know that it's not, do not accept that. Because typically we start looking at x-rays and we're looking for different things. I said, honestly, a lot of times neurologists, they're looking for cysts and tumors and things like that to see if that's what's causing your problem. She's like, yeah, but aren't they nervous system doctors? And I said, yeah, they are. But we're still looking for different things.
Yeah.
And I said, it's kind of like if we both were mechanics and, I work on the engine and they work on the brakes, and you take your car to that mechanic and say, hey, can you look at my engine? The light's on. And he's a mechanic, but he only works on brakes. And I said, realistically, we're trained to do different things. And I said, that's why we're able to help so many people. And also I said, it's, what do you want for your result? Because typically you go see a neurologist or a neurosurgeon or an orthopedist, it's drugs or surgery. And I said, if that's what you want, then you go down that path. But if you want something different, if you want not to have to take those things, you want your body to heal naturally, that's what we do. We can help start to remove interference, help your body start to heal and change the outcome. And she's like, wow, that just makes sense to me.
And that's a huge point there, is just walking people through. I mean, the lights just turn on for people when they're like, should I go see a neurologist for this? Should I go see an orthopedic for this? And my next question is, okay, well, are you wanting to do the types of treatment that they're going to give you? Because you have to understand that if you go to an orthopedic for a low back pain, what are they going to do? They're going to give you an anti-inflammatory. They're going to give you a muscle relaxer, a painkiller. Okay, so the first question is, and this may, and a lot of times I'm speaking to the person. It's like, oh, I don't even take Advil. I don't even know. Don't touch any of that stuff. So, okay, well, are you willing to have an injection done?
Right.
No. Are you willing to have that? No. Okay, so the next thing they could do, if it's bad enough, they could fuse it together. They could do a laminectomy, a discectomy. They can do some type of, no, don't do surgery. That's what the patient will say. No, I don't do surgery. Say, okay, well, this probably doesn't sound like a good fit for you.
Right, yeah.
Okay, so it's the same thing. It's for somebody that comes into our office. Walk yourself through that process. Do you want to do surgery? Do you want to have medication? If the answer is yes to those, then our office is not a good fit for you.
Right.
Okay, so it goes both ways. But ask yourself those health goals. What do you want out of this? How do you want to get well? And a lot of people, even listening to this show, they may want to get well through drugs and through surgeries because they may feel like that is the only option for them. I'm here to tell you it's probably not the only option, but if that is your prerogative and that's your mindset, then you need to be in that environment that's going to give you drugs and surgery. But there's so many people that are looking for an alternative to that don't want to take drugs or surgery, or have done the drugs and the painkillers and the steroids and they're failing them. They're just not working, or they worked for a small period of time and they're not working anymore. So you got to get yourself to a point where you understand, I can go somewhere else, I can get a second opinion, I can get a different opinion about how do I get well. And that comes back to, how are we going to give you that opinion? And we're going to give you that by looking at the nervous system, looking at the spinal column, seeing what kind of stability you have in your spine, and any neurological interferences that the instability in your spine would start to cause. And if that's in there, we start to remove that interference, remove the dysfunction, allow your body to start healing with that innate intelligence that God gave you. It's pretty simple process, and we know specifically on, the great thing is we know specifically on how to do this because of the specific x-rays we'll take, because of the way we're trained to how to do spinal correction, because of the adjustments, the rehab in the office, the home exercises, the things that are designed specifically from your x-rays to start to remold the muscles and ligaments and everything in your neck. Another big question you get, Dr. Rick, is like, well, should I do physical therapy? Should I do acupuncture? Should I do massage? All those things. Just realize those things are all great. They're just different than what we do.
Yeah.
It's not spinal correction when you're going to any of those other things. So we're not specifically taking, bony arthritic problems off of the spinal column. That's what we do, is for when the spine is shifted, the bones in your spine, when they are shifted, we adjust them, we start to move them back to the right position. And that's not painful, by the way. A lot of people might hear that and say, is this painful? I've never been adjusted. You have some people that come in that are new, like, what is an adjustment? Like, you keep saying adjustment. What does that even look like? So obviously we'll show you what the adjustment looks like. You'll be able to have an adjustment with us, and then you'll start to understand, okay, this is the process of how we're going to start to move the spine back to the right position. That's going to help me with my headaches. That's going to help me with my numbness and tingling. That's going to help me reduce my medications because my body heals better. Those are all things that sound amazing in my mind. I hope they sound amazing in your mind. If they do, then it makes sense that you would call, that you would make an appointment, that you would come check this out. It's $40. That's all you have to pay. You pay that over the phone. That's going to cover the initial exam and consultation. And then you'll have, if we need to take x-rays, there's an additional fee for that. It's nominal. We'll show you what that is just depending on what x-rays we need to take. So that's why we don't take that over the phone, because we haven't met you and we don't even know if we will need to take them. So that number is 877-778-6978. One more thing is you can listen to us on YouTube. It's Max Living 100.7. Just on YouTube, just search that in if you want to hear this whole episode in its entirety and see us in studio.
Well, and it's the new year, and so a lot of people are making those resolutions, or whatever you want to call it now. People are coming up with all these new names because nobody really sticks to resolutions anymore. But as the new year approaches, a majority of people do look at that and say, okay, I know I need to make changes. I need to do something different. So why not start with the most important thing, and that's your nervous system, taking care of your spine. And most people have no clue what it looks like, how it's supposed to be positioned. And as we walk through that with you, your eyes brighten, the lights come on, you realize, like, yes, I know that I need this. But it really boils down to, how is your nervous system functioning? How is that working? And we ask people all the time, like, how many times have you had this checked? How many times have you been to the doctor and they've looked to see how your spine's positioned, how your nervous system's positioned? And a lot of people say never. Even though they've been to a chiropractor, they still don't know what's going on in their spine. We've had quite a few people come in recently that have been to other places that, they walk in and, they got their neck cracked and their back popped. They got adjusted. And no explanation, no x-rays, had no clue what was going on. Yep. And so what a missed opportunity. But that's part of the power of what we do, is helping you explain how your body functions and heals so that you can make the best choices for yourself.
And that's the first couple of appointments are all education.
Yeah, helping you understand. So the number is 877-778-6978. We have an office in Plano, McKinney, Fort Worth. Guys, please call in. It's $40 to reserve your spot, covers the exam and the consultation. We love you guys.